And Health and Human Services Secretary RFK Jr. is removing all vaccine experts from a key government panel. He's fired all 17 members of an independent CDC advisory committee that makes recommendations on the safety, efficacy, and clinical need for vaccines. Kennedy insists a clean sweep is necessary to reestablish public confidence in vaccine science. Now, several public health groups say they have serious concerns. ABC's Lionel Moise has that story.
A massive change by Health Secretary Robert F. Kennedy Jr. removing all members of the CDC's Vaccine Advisory Committee, which makes recommendations on the safety and efficacy of vaccines. Members getting a notice saying this email serves as formal notice of your immediate termination. Kennedy releasing a statement saying, "Today we are prioritizing the restoration of public trust above any specific pro or anti-vaccine agenda." Kennedy argues a clean sweep is needed to restore public trust, claiming the committee had conflicts of interest, adding the Biden administration appointed all 17 current members, with 13 of them last year. But critics have called this change dangerous and partisan.
Remember, this is the same man that just told you at his Senate hearing he would never take vaccines away from anyone, and he's doing that. This is the same individual who said, "Don't take my advice, I'm not a medical doctor."
Do you think that there needs to be a change in the process on how this board is appointed?
You and I don't ask when our pilot is flying our plane, are you a Democrat or Republican? You ask, can you fly this plane safely? Do you have the experience and the expertise to do that? That's what this committee was all about. And it has served us very, very well over the years.
Lawmakers also reacting. Senate Democratic leader Chuck Schumer calling the move reckless, radical, and rooted in conspiracy, not science. Republican Senator Bill Cassidy, who is a physician, posting on X, "Of course, now the fear is that the ACIP will be filled up with people who know nothing about vaccines except suspicion," saying that he will continue to talk with Kennedy to ensure that's not the case.
Lionel Moise, thank you. And let's bring in senior scholar at Johns Hopkins Center for Health Security and Infectious Disease Specialist, Dr. Amesh Adalja. We appreciate your time today, Doctor. What's your initial reaction to this move by the health secretary?
This was something I expected him to do. RFK Jr. was selected for this position to do this type of destructive work when it comes to vaccines. And I think that what we've seen over the several months that he's been in office is step by step dismantling the infrastructure for vaccines, making the vaccine ecology a very difficult place for vaccine developers to be in. And what it's going to do is undermine the value of vaccines in the American people's minds, which is exactly what he's been doing for 20 years. This is no different.
How do you see this impacting public health in the short term and long term?
Well, I think that what's going to happen is people are going to completely lose trust in government institutions because they're being polluted by all of RFK Jr.'s ideas and his compatriots that come from the anti-vaccine movement. So people are going to increasingly tune out what the CDC says or what the FDA says because they're worried that RFK Jr. has made it even more political than it already was. And what that does is it also erodes people's idea that vaccines are important. You don't have people advocating for vaccines in the same manner. And you have a really muddled structure of how vaccines get recommended, what insurance companies pay for. And in the end, if you're someone in the public who doesn't follow this day by day, you may just throw up your hands and not know what to do. If you're a vaccine developer, you may say, I don't even want to make vaccines anymore. Let's work on cancer drugs or something where there's not so many minefields to go through. And I think what it does is it makes the US less prepared for infectious disease threats, emerging infectious disease threats, and the endemic threats that we face every day, like measles.
So RFK Jr. says we needed a clean sweep to reestablish public confidence in vaccine science. Could a new team of experts help improve public trust in vaccines?
Not if they have any allegiance to RFK Jr. If RFK Jr. likes somebody, that's probably a red flag that this person is not going to be scientifically based, that this person might not believe in the scientific method or even the germ theory of disease like RFK Jr., who doesn't even believe HIV is the cause of AIDS. So if somebody is agreeable to RFK Jr., that should raise all kinds of concerns because this is an anti-vaccine advocate. This is the chief propagandist for the anti-vaccine movement. So whatever clean slate he puts in place is going to be a disgusting slate when it comes to what I think would be what you want an advisory committee to be able to do. These are people who do not believe that vaccines are of value. They don't believe that vaccines are a tool that humans use to live in a world where there's infectious disease threats. So I don't think that anything he does is going to be good for public health, good for human life, good for vaccines, good for innovation. It's the opposite.
All right, senior scholar at Johns Hopkins Center for Health Security Infectious Disease, Dr. Amesh Adalja. We appreciate your time today. Thank you.
Thanks.